Cancer remains a leading cause of death. According to the World Health Organization, statistics show that nearly 10 million deaths and nearly 20 million cases were recorded in 2022. Approximately 1 in 9 men and 1 in 12 women will die from cancer. An estimated 9.74 million people died from cancer in 2022, and 19.6 million cases were recorded according to the International Agency for Research on Cancer.
Cancer can be defined as abnormal growth of cells that can no longer be controlled by body regulatory mechanisms, so that the cells will grow and cause a lot of problems. It can affect any part of the body. Okay, so we have different types of cancers. Lung cancer affecting the lungs, breast cancer affecting the breast, colorectal cancer affecting the intestine, the large intestine. So many, prostate cancer. So presently, we have breast cancer as the #1 cancer in the whole world, followed by lung cancer, and then followed by colorectal cancer, in that order. Causes of cancer generally will be attributed to family history. If people in the family had cancer before, the offspring may be at risk. It can also be attributed to some syndromes, some other diseases that can trigger the development of cancers. For instance, what we used to take lightly as ulcer affecting the stomach, if not well treated, can give rise to cancer of the stomach. Okay? The lifestyle indiscretions, smoking. In fact, smoking is implicated in almost all the cancers. It's a very dangerous thing. Alcohol intake, excessive alcohol intake can cause cancer. Then we talk about certain infections. Like cancer of the stomach is an infective cancer. Cancer of the cervix can come from infection by human papilloma virus. So infections can give rise to cancer. Okay. And then environmental factors, exposure to dangerous chemicals. So these and many others can give. Symptoms can only be explained based on the different types of cancer. Okay. Yes, like let's take the breast cancer, which is #1 in the whole world. It used to be lung cancer until about 2022, breast was able to overtake lung cancer. Symptoms of breast cancer, the woman will feel breast lump. Not all lumps are cancerous, but the majority of the cancers will start as breast lumps. And that is why we advise that women who notice breast lumps should go to the hospital, let the doctor decide which is which. Some can start as nipple discharge. The woman is not breastfeeding, but when she touches the breast, something will come out from the nipple like breast milk. It can be a sign of cancer. Some could start by as nipple retraction. You see the nipple that was pointing forward being pushed inside. Can start as swellings in the armpits. We call it in medicine axilla, because of involvement of lymph nodes. There are some advanced cases. You see bone pains, jaundice, the eyes are yellow. So that could be a sign for breast cancer. For lung cancer, the patient might have persistent cough that has not reduced despite medications. He has not stopped. He moved beyond 2 weeks, 1 month, 3 months, 6 months. And then this cough begins to bear some traces of blood streaks. When you cough it out, you see blood in it, in the sputum. And then the patient will feel pains in the chest, will begin to lose weight, will begin to have anorexia, lack of appetite, cannot eat. So for lung cancer, we said that you must first rule out chronic cough caused by tuberculosis. If you rule out tuberculosis and the cough is still persistent, do a check for cancer of the lungs. The third cancer is the colorectal cancer, cancer of the large intestine. That one could start by the patient not being able to go to toilet normally. Every day when you wake up, you will go to toilet in the morning before going out. But you realize you can stay for 2-3 days without going to toilet. And then when he wants to come, you have to do a little enema to assist you in pooing. And then sometimes it comes as diarrhea. And then there are some category of patients that they will just be passing dark diarrhea stool. Their feces are dark in color. Some will pass out pellet-like. You know the feces of a goat, tiny, tiny like that. If you pass through and you see it coming out in small, small pellet-like caliber, it's a sign. Or you see blood coming out from your anus, you should go for screening so that we can detect it on time. Because cancers are categorized into 3. The first group is a curable cancer. Cancer of the colon, if detected early, can be cured. Cancer of the thyroid can be cured. Then we have the second group we call potentially curable cancer. Breast cancer belongs to potentially curable type. Because if you detect breast cancer early, that woman should achieve a cure. And then the last one is a incurable type. You can only offer palliative care. Okay. What is the way forward? The theme for this year's World Cancer Day is let's close the gap. Every patient should have access to cancer care, and which is a problem in this part of the world. The problems we have here that appears as if the cancer burden is higher in this part of the world is that, one, inadequate facilities for screening. You want to send a woman for mammography. How many places have mammogram? It's a problem. Inadequate facilities, inadequate trained manpower. How many oncologists do we have? We may have doctors around that treat general illnesses, but for cancer care, you need people who would have been trained specially in oncology. And we have them surgical oncology, we have radio oncology, we have medical oncology. They play a role in cancer care. So we don't have such skilled manpower enough. And then when you go to care, drugs, expensive drugs, high cost of drugs. Do you know, for example, a woman that has what we call HER2 positive breast cancer, that woman will require not less than 1.5 million naira every 3 weeks for 1 year for treatment. Because the drug for targeted therapy for that type of cancer is very expensive. So you just realize that as soon as you diagnose the woman of that type of cancer, it becomes a death sentence. Because, from where would she start? The few ones we've seen have had to go and sell their household items, landed property. And they were able to buy the drugs. And they are alive. Because if you're able to afford the drugs, you will live. So high cost of drugs is a problem. Another problem is late presentation because of inadequate awareness. Cancer that is potentially curable, that should have been seen in stage 1, will now present to the doctor in stage 4, which is advanced. And there's no magic any doctor can do at that point. And that is why I like what some groups are doing now. In Akwa Ibom State, Medical Women's Association will be staging a walk around the city to create awareness, to raise an alarm that something is happening. Go out and be screened. So, late presentation is a problem. And then another problem I want to talk about is government's insensitivity to the plight of these patients. You just see a new government that comes on board, and all that concerns the people is road construction. It's good. It's good to construct roads, to build skyscrapers. But how about the health of the people? And when you go to the health sector, how much budgetary allocation is given to health? What percentage? World Health Organization says every country should budget not less than 15% of its total for health. But this year, I think, is less than 5%. Go to state governments. What is the percentage given to health? And now, what came on board as National Health Insurance Authority, the National Health Insurance Scheme, managed by NHIS, should be expanded to cater for the cost of drugs for these patients. But presently, NHIS can only take care of a percentage of some drugs. The rest of the drugs, patients will have to cough out money and pay.
With the 2024 theme, Close the Care Gap, medical experts say it is imperative to enable more access to cancer care.
So I call on the Akwa Ibom State government to bring a radiotherapy machine to Akwa Ibom State so that our people here can have access to adequate care. There are many treatment modalities for cancer. Radiotherapy is one, surgery is two, chemotherapy is another modality, immunotherapy, targeted therapy. In Akwa Ibom State now, we can do all the modalities except radiotherapy. What can we do to reduce this burden? Preventive measures. We should be able to exercise and guard against obesity. Don't be too fat. Go and exercise. Lose weight. Have appropriate body mass index. We call it BMI, which is a score given to each individual based on the height and the weight. Normal should be between 18.5 to 24.9. Once it hits 25 to 29.9, that is overweight. That is a stage something should be done drastically. Once it is 30 and above, obesity has set in. So, we should avoid sedentary lifestyles. We should exercise daily. Women that have big hips should do something about it. There's what we call hip to waist ratio. Once the score is above 1, that woman is at risk. May develop breast cancer or another type of cancer. Then diets. Our people do not want to eat afang soup, these vegetable soups that God gave to us. We want to eat shawarma, ice cream, meat pie, pizza, westernization of our diets. So a whole lot of cancer of the stomach, cancer of the colon, they come from westernization of diets. Beef shouldn't be eaten regularly because it has polysaturated fatty acids that will give rise to a huge store of carcinogens. But chewables like fish, very good, seafood, periwinkle. Let our people go back to periwinkle. Whether you are driving in Prado Jeep, stop and buy periwinkle. Buy fish, crayfish, crabs, prawns. They have rich components that will keep the body firing, that will generate antioxidants to keep away those free radicals that wear down the cells. So dietary control is very important. We should avoid smoking. We should avoid alcohol intake. And then we should examine ourselves. And when we notice something wrong, we should rush to the hospital. So screening programs should be embodied in our budgets for the health sector so that these cancers can be detected early on time. Training of manpower. Let government sponsor doctors instead of having a collection of general practitioners. Take some, send them for specialty training. And then intervention in procurement of drugs will help those that are affected to live longer. NAFDAC should work harder to eliminate fake drugs.
The need for people to embrace regular medical check and no family history was also emphasized as early detection, according to the medical experts, remains key to surviving cancer.
Before this millennium, we were eating more of vegetables, all those raw veggies and all of that. But now we are now tending into, the whites. We are eating Western food like pizza and shawarma and the rest. I'm also guilty, but I'm not saying it's right. So I think if we should go back to our previous lifestyle, it will help us a lot. Then another factor that causes breast cancer is use of oral contraceptives. So oral contraceptives are drugs that people use to prevent pregnancy. So let's use an instance where a couple that has already had a number of children that they want to have. So if you want to stop having children, contraceptives are the drugs you take. So let's say if you have made that decision with your partner and you want to take contraceptives, you don't just walk into any pharmacy and get drugs. You meet a professional to get it for you, because most of those drugs have so many side effects, and one of them is cancer. So if you should meet a doctor, you'll be able to, get rid of that risk factor. Then exercise, so we should exercise, you should have a healthy lifestyle. When you are living a sedentary lifestyle,
so like every other cancer, lung cancer is, I think, the second leading cause of death in the world, and it is very dangerous. As you know, we survive on respiration. If you can't breathe in, breathe out, and oxygen gets to all parts of your body, you're a dead person. So first of all, lung cancer, one of the risk factors is smoking. As you know, when you smoke, some of that smoke gets into your lungs and it is deposited there, and over time it can cause a change. And you know that the thing is, when you talk to people, most times you hear, this one has been smoking for 15 years, not smoking for 10 years, nothing has happened. It's not always an immediate effect. It takes time. Some of these things take time. They can come up when you're 50, when you're 60. And another thing is, there doesn't always have to be a family history. Your father might have been smoking, he did not have it. Your great-grandfather might have been smoking, he did not have it. Does not mean that in your time you cannot come and have it. So it is just best to prevent that when everyone. Even things that we take lightly as drinking can lead to lung cancer, because drinking actually is a risk factor for all cancers, including lung cancer. When we say drinking, most times people think that if you drink maybe 3 days a week, 4 days a week, it's very normal. It's not very normal. You should limit the way that you drink. Drinking is not like eating. And when I say drinking, I mean alcohol. It's not like eating. It's not something that you should do regularly. It's something that you should do occasionally and in a limited amount. And then some of the symptoms when you have lung cancer that you can develop is difficulty breathing. You find that you're finding it difficult to breathe. You can just be lying down and all of a sudden you can't breathe well. There could be chest pain, there could be coughing out of blood, there could be bone pain, there could be jaundice, that's yellowing of the eye, weight loss, you lose appetite. And one thing that's very important with all these cancers is that you present to the hospital very early. Early detection is key to saving life because cancer is very aggressive.
We're talking about this year's cancer team. It's closing the gap. And it means that we have to cross the bridge between the patients, the cancer patients, and the facilities that are able to acquire is very long. So closing the gap means that they are able to access the care they need on time and when they need it. Okay, the things that we can do to close that gap means the drugs are quite expensive. It will help them a lot if they can subsidy can be made so that these drugs can be easily accessible for them. The drugs are really expensive, and most of our patients, when they come to taking drugs, they don't comply with the drugs because they can't afford it. Also, another thing is the primary health care facilities. They are not able to make the diagnosis for this cancer because they lack the facilities. Like my consultant has talked about the radiotherapy. They lack this facility here, so they are not able to access it. So if the government can be able to subsidize these things and make it affordable for us here, it help our patients to survive more.
As you all know, cancer is something that we cannot really prevent. According to how it comes about, it has so many risk factors ranging from age, sex, the kind of food you eat, the kind of environment you are exposed to, and a lot more other things. But it is also worthy of note that cancer is not a death sentence. I think there are a lot of drugs that are being produced now to fight against cancer, so it's not a death sentence actually. And then one thing to know about the progression of cancer is that it is best. The treatment is always best whenever it is noticed on time.
After meeting with medical practitioners on today's commemoration of World Cancer Day, everyone have been asked to collectively work together to reduce the social stigma associated with the disease and to get themselves checked regularly to achieve a healthier and brighter world free of cancer. Wang Von Walter, Spectrum Television.